contraception, it's just a method of preventing pregnancy.
Okay.
It could be medications that you take. It could be a device that is inserted into your body. But the sole aim of of contraception is prevention of pregnancy. So, of course, we have emergency contraceptive pills that we take in order to prevent pregnancy. This is done immediately after sex, or as quickly as possible after sex, just so that you achieve the sole aim of prevention of pregnancy.
All right. But Nosvi, I would like to ask, how does contraception prevent pregnancy? How does contraception pills prevent pregnancy?
For the pills, they're like, of course, pills, it's tablet. Now the physiology, how it happens is that, when during sexual intercourse, sperm is released. Now this sperm, if nothing interrupts it, if it's a healthy practice, if it's a smooth process, it goes ahead to fertilize egg, and then that's how you get pregnant, and then you have baby. But when you take contraceptive pills, the drug interrupts this process. How this is done is, first, if the drug is taken prior to ovulation, the drug kind of prevents ovulation from occurring. That delays it, or if it doesn't do that, it also kind of thickens, the mucus, this in the vagina or cervix. There are mucus secretions that a woman have. Now, if you're not pregnant, this secretion is really slimy and slippery, so the sperm can easily maneuver, find its way to the womb, and then to the fallopian tube. The fallopian tube is the tube that from where egg is released from the ovary, so it passes through the fallopian tube to the womb. So this contraceptive pills kind of thickens this mucus, this cervical secretion. When it's thick, it's difficult for the sperm to swim through. So since sperm stays alive for 5 days, if all the efforts of this drug is to thicken this secretion, not which slows its movement, and then the sperm eventually dies.
I'd like to ask, when should I think about using contraception pills? Like, is it every time I should be using it, or are there specific times we are meant to use contraception? So please let our viewers know. So,
all right. Many people make the mistake of having sex, so to say, at say today, and then they decide that it's later days, say the next 1 week, that they remember, oh, I had sex on Friday, for example. Then they will remember to take the medicine. For emergency contraceptive pills, like I said earlier, sperm stays alive for 5 days, so you have to take as urgent as possible within the first 24 to 72 hours after having sex. It's not magic. If you delay the process, in fact, the earlier the better. The earlier you take this drug, so it starts eliciting its action, the better. So if you delay the process, then there might be risks. The egg might already be fertilized before you take the drug, and of course there's little the drug can do at that time.
okay.
And then there are other contraceptive patterns, there are other methods. Instead of taking drug, people are ignorant to the point that every time they have unprotected sex, instead of exploring other contraceptive methods. Now basically what contraception is preventing pregnancy. So anything you do to achieve this aim is contraception. So you can use the withdrawal method, you can decide to explore other methods like monitor your cycle, study your cycle, so you know when you're safe and when you're not safe. Then for those that already have family planning methods done on them, like they're taking drugs, or they have implants, or they have what we call the uterine contraceptive device, IUCD, all these are methods that you can use to prevent pregnancy. You don't have to every day have sex take emergency contraceptive drugs, the all known Postinol 2 that everybody knows about. You cannot do that all the time. Of course, there are side effects of it, which we are going to eventually talk in the course of this live video. We're going to talk about it. But I'd advise that not every time you have sex, you have to take this drug. Try other methods. Of course, use protection, barrier method, use protection, or withdraw or something.
Alright, so I personally have taken note of two things which is said there are other methods for us to prevent pregnancy, and also it's not a regular thing, it's not something you have to be taking. The pills are not something you have to take every day, so we should sometimes try other methods. Thank you very much, Nurse V. Now, we would like to ask again, Nurse V, will emergency contraception pills affect our next, like for the ladies, will it affect their next period? Yeah.
I would say yes and say no. Now,
Alright.
yes, because everybody is different. Every human is wired differently. What I react to might be different from what you react to and what the next person react to, because that's how our bodies are. So for some persons, they don't react. Whether they take 5 tablets of Postin or 2 this month, and they've had the course to take 5 times, it doesn't do nothing to them. Their cycle is still normal. But for some persons, one of the side effects of the drug is that it either makes your period earlier. Say, for example, you're supposed to have your period next week. It can make it 1 week earlier or make it 1 week later. This is just a side effect. Or you can either have this month, because I took the drug, my flow will not be that much. It's not going to be the normal ones. Let's say it flows for 5 days. It might not flow well, or you're going to have heavier flow. So we are not surprised when people come up with these complaints. There are some people that take these drugs and don't even have any of these complaints at all, like never. So that's why I said everybody is wired differently.
This city never sleeps. I hear the people walk by when it's late.